I find that when I'm getting stressed, I have to kind of step back a little bit, relaxed, maybe do a little meditation. Otherwise, everything just goes out of control with me.
Yeah. I like to go outside and get away from everything, out by the pool or something, and just have 5 minutes to myself and just refocus.
Managing the stress, it's different with everybody. I learned how to take more walks, not get quite as upset at my children for the small things. And the biggest thing was learning how to take care of myself and step back when I knew that I had to.
There's a support group that I started with 8 women, and we just started seeing that people need a place to go and to talk. And there's not a lot of people who have HAE since it's so very rare. So having a place where you can take it to, I think it's a really big way to help with stress.
When I'm getting into a stressful situation, first thing I always try and do is step back. I like to kind of, you have to take that deep breath. Before I was diagnosed and started learning the different triggers, I used to get more worked up. And I've learned all that does is create more swelling, more problems.
Being in school and having friends you're hanging out with, having sports that I'm practicing or playing in, it's hard for me to leave my friends because we're usually having a good time, and I don't want to be the one that leaves first and have to miss out on things that are going on with them. But sometimes, you have to, because I'd rather miss out on those moments than wake up and have an attack.
Any activity that will keep stress down is a good thing. Whether it be painting or going for a walk or just sitting in your backyard and watching the birds. It doesn't matter what it is, just find that thing.
Swimming seems to be one of the best activities. It's low impact on the body. Can be quite enjoyable. Take the kids out, everybody just have a good time. I've found that walking is very beneficial. Again, it's a low impact. You can get some good exercise.
I also like to do Zumba when I'm able to. It's fun and exciting, and it allows me to feel like I'm halfway normal again. So it's really important to find that balance between having the physical activity that our bodies need and managing hereditary angioedema at the same time.
Having Ruconest to treat us well and being able to administer it myself, I can take it wherever I go, I can have it at home if I need it, and I'm able to do all the things that I need to do, school or work or doing some activity, whatever it is. With Ruconest, I'm able to administer the medication, and it's going to work fast. It's going to work for at least a couple days, and because of that, I'm not worried about having another attack. I don't have to stress out about it.
Part of my go bag is my emergency care plan, which my doctor and I sat down and worked out. It explains what I have, the things that work, the treatments, the medicines I'm on, how much, the dosage. It makes it nice because I can walk in, hand the doctor the note, and have them read through it and know exactly what I'm going through.
One great resource that I've used is the Ruconest patient advocate nurse. I'm able to ask her questions. She checks in probably about once a week just to see how I'm doing. It helps me to help myself, really, knowing that someone else is concerned enough to make sure I'm on top of my health, because sometimes taking care of kids, I forget about myself. And having that person just check in has been very beneficial for me.
What is Ruconest? Ruconest is an injectable medicine that is used to treat acute angioedema attacks in adult and adolescent patients with hereditary angioedema, HAE. Who should not use Ruconest? Do not use Ruconest if you have experienced life-threatening immediate hypersensitivity reactions, including anaphylaxis, to Ruconest or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums that turn blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use Ruconest if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Ruconest is not indicated for use in children under the age of 13 years. What should I tell my healthcare provider before using Ruconest? Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. Ruconest has not been evaluated in pregnant women or nursing mothers. You and your healthcare provider will decide if Ruconest is right for you. How is Ruconest given? Ruconest will be dissolved in sterile water and slowly injected into your vein. What are the possible effects of Ruconest? The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of Ruconest. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events and product complaint reports, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.